Good morning, friends. Assalamu alaikum. Today we will see the position of a patient in different lung disease. What should be the ideal position of a patient, whether he is at his her home or he has been admitted in the hospital? What should be the ideal position of a patient in the bed, so that his ventilation will improve, so that there occurs the perfect ventilation perfusion matching. So let us first see the position of a patient in effusion, in pleural effusion. Pleural effusion. Pleural effusion is the uh, accumulation of fluid within the pleural cavity. Pleural cavity, is the potential space between the two coverings of the lung, that is between the visceral and the parietal pleura. It is a potential space. Normally, um, it contains the pleural fluid, and in some pathological conditions, it gets engorged. It gets filled up with some with different fluids. So the position, we are going to see the position. What should be the position in pleural effusion? Uh, mm, um, the ideal position is the affected affected lung lung up affected lung up with with unaffected with unaffected affected as dependent lung with the side inside lying position, side lying. For example, if this is the lung, if, if these are two lungs, these are two lungs of the patient. These are this is the trachea. These are two principal bronchi, and if this is the affected lung, this is the affected side lung. Affected, unaffected lung, or normal lung. This is the pathological lung. For example, if the patient is having pleural effusion, we will keep the affected side lung up, and the unaffected lung will become dependent. This is the position in pleural effusion. Now, what should be the position of a patient in pneumothorax? Pneumothorax. Pneumothorax means the accumulation of air within the pleural cavity. For example, if these are the lungs, these are the lungs, these are two primary bronchi, and if, for example, this is the affected side lung, left lung has two lobes, right lung has three lobes, upper, middle, lower, upper and lower. If this is the affected side lung, left lung, if left, right. If this is the if this lung is having the pneumothorax, you will keep this. You will keep the patient in side lying position with the affected side lung, that is pneumothorax side lung, upwards, and the normal lung will become dependent in this case. That means the position in pneumothorax is same as in pleural effusion. Okay, Now let us see the position of a patient in different lung pathologies. Let us see the position in atelectasis, atelectasis, atelectasis. Let us see in consolidation. Let us see the position in lobectomy. These are and the few pathologies, few conditions which are most common conditions you will come across. Atelectasis, it means the collapse of the lung partial or the complete collapse of lung alveoli are not able to get inflated, and consolidation, this means the accumulation of disease products within the smaller airways like pneumonia. Lobectomy is the surgical removal of the lobe of the lung in different conditions like in CA lung. So let us see the position. For all these positions, you need to remember once for the all, for once forever, the rule. The rule is a rule. This is the basic rule. The rule is bad lung up rule. Bad lung up rule. What does it mean, bad lung up rule? In every condition, for example, if these are two lungs, if this is the trachea, these are primary bronchi, if for example this is the right lung, the left lung, and the right lung is affected, left lung is normal. In all these conditions, whether it be atelectasis, whether consolidation, whether lobectomy, in all these conditions you have to keep the affected side lung, pathological lung or bad lung, you have to keep it upwards. This is the basic rule of this pulmonary ventilation. Whether the patient is at his her home or whether the patient is in hospital. Um, when you are the supervisor, when you are the professional at hospital dealing with the patients, you have to keep in mind the patient is having atelectasis, so we have to keep this side atelectatic lung upwards in order to have the optimal ventilation perfusion matching. What is the reason behind this? What is the principle behind this bad lung? What is the philosophy behind this bad lung approval? It is very simple. Bad lung up. There are two lungs. For example, this is the affected lung. Affected lung. This is the unaffected lung. When you will keep the affected lung upwards, that means the perfusion. Since this is the affected lung, the perfusion means the blood supply to any tissue or organ. The blood supply will be diverted towards the dependent lung. In bad lung approval, the dependent lung is unaffected lung. So the perfusion will increase towards the unaffected lung due to gravity. Is it okay? Now, since this is the affected lung, it will have more dead space. It will have less decreased ventilation. Decreased ventilation. Since this is a normal lung, it will have the normal or good ventilation. Ventilation. Perfusion is increased on this side. Perfusion is increased. Ventilation is increased. That means the ventilation perfusion ratio will be optimum. Optimum. Perfect optimum on the unaffected side. Perfect matching will be on the unaffected side. Um, on the other hand, if you will keep the affected side lung downwards, the perfusion will increase towards the affected side lung, and but ventilation is greater towards the unaffected side. It will decrease the it will have the it will not optimize the ventilation perfusion ratio. This is the reason behind bad lung approval. But there are some exceptions to this rule, and you have to remember all those exceptions. In fact, there are only few exceptions. For example, the first exception to the bad lung rule is the recent pneumonectomy. Uh, if any patient is having say lung, that lobe or that part of lung will be surgically removed, and uh, and if it is recent, so then this is the exception to bad lung approval. In this case, you have to keep the bad lung or affected lung or pneumoniectomized lung dependent. Why? Because fibrin, the reason being the fibrin and the fluid that will accumulate in the pneumonectomized side when it is dependent. So that will prevent the mediastinal herniation on the affected side lung. This is the reason of it being the exception. Number second exception is the large pleural effusion. Why large pleural effusion is exception? It is because when the pleural effusion is large, if you will keep the large pleural effusion side up, it will compress the normal lung. When it will compress, it will decrease the perfusion, it will decrease the ventilation. There will be the mismatching of ventilation perfusion ratio. So this is another exception. And the last but not the least exception is the bronchopleural uh, fistula fistula bronchopleural fistula. If there is the fistula has formed between bronchus and the parenchyma lung parenchyma. This is the exception. Why? Um, it is because in this case the unwanted substances will drain into the affected side. For example, if this is the lung, if these are the lungs, if this is the trachea, these are primary bronchi. If this is the affected side lung, and this lung has, if this is the affected side lung, and this lung has bronchopleural fistula. Here is the bronchopleural fistula. The unwanted pathological waste will go into the normal side lung. So that is why the bronchopleural fistula is also the exception to bad lung approval. This is all about the positioning of patient in different lung disease. Hope you have understood the basic concept. I think this is enough for today. Thank you.